After I was diagnosed with coronary artery disease, my life was completely changed. I was extremely apprehensive about my health and well-being. I couldn't do anything or go anywhere. I was even wary about playing too actively with our grandchildren, in case it made me ill and I suffered another attack. I also had to attend regular checkups with my GP, and also at the heart clinic, which happens to be almost 3 hours away. It took a whole day, waiting around, being poked and assessed. The whole thing left me utterly exhausted. Basically, I was a nervous wreck. When I first heard about SmartMed from a friend, I thought I'd give it a try. I had nothing to lose. My GP told me it might help reduce my anxiety about my heart condition. It enables me to take several vital signs readings, such as blood pressure, blood sugar, my weight and my pulse rate. It doesn't matter if these readings mean little to me, because they're all being backed to the clinic over the internet, and someone who knows what it all means checks them on my behalf. It's essentially like having your own private doctor on hand to keep an eye on you, without having to leave the house. Setting up the monitoring device couldn't have been easier. My community nurse came round and set it up for me and showed me how it worked. But to be perfectly honest, it was so easy to use, I could have worked it out for myself. She showed me how to use the monitoring devices like the blood pressure meter and the glucometer, and how to take the readings from them on the device and send them off to the clinic so they can check everything is all right. Within minutes, I was set up and ready to go. Each day I have to take a series of readings, usually in the morning. For my heart problems, I need to take my blood pressure, pulse rate and blood oxygen levels. I also take my glucose levels because of the diabetes. I rarely forget to do my tests, but if I do, my phone beeps at me and reminds me. It's like having your own little medic keeping an eye on you. When I'm ready, all I have to do is put my finger in there and it turns on and lights up on its own. I then press a couple of buttons on the phone like this. After a few seconds, I get a blood oxygen reading on here, and the same thing pops up on the monitor there. And then I just confirm the reading. That's it. I then do the same with my blood pressure meter. I then take a blood sample with my glucometer. It's only a pinprick, and I only need a tiny drop of blood. So after a few goes, you get used to it. If I want to, I can look at my own readings to check that I'm hitting the targets the nurse set for me. And that helps me with my diet and exercise and other things. I prefer to leave that to the experts though. That's what they're best at.
Janet was very upset about her condition, and it was making her more ill and affecting the loved ones around her. SmartMed has given her a sense of control and empowerment. It has given her the confidence to get involved and proactively manage her health and well-being. Patients' readings like Janet's come through to the clinic on the SmartMed web portal. Using the data, we can check how the patients are progressing and if there is any danger signs that need intervention, like maybe a phone call at home to check if they're okay, or a home visit, or maybe an appointment to the clinic for further investigations. Before SmartMed came along, we would have to wait for the next clinic visit to check how the patient's condition was being managed, or for the patient to get ill and have to visit the GP. That was often too late. But with this system, we can make interventions much more quickly and effectively, and we can focus on making more regular home visits to patients that are in most need. Also, because clinical interventions are more timely, we can reduce the pressure on hospitals and clinics. With fewer inpatient and outpatient admissions, and when patients do undergo surgery, we can release them to their home quickly, knowing that we can keep an eye on them and an eye on their recovery through SmartMed.
Illnesses are essentially the patient's problem, and it's really crucial that we involve them in looking after it. It's not good enough for doctors to be telling patients and health professionals to be instructing them on what to do. And I think the technology now, where patients are actually taking their own results, taking their own observations, and then using mobile technology to feed them back, is really good because they are empowered and very much involved.
We created SmartMed because we wanted to help healthcare providers around the world hit the challenge they're facing through the rise in chronic illness head on. With the rise in the availability of mobile technology and applications such as SmartMed, anyone everywhere has the same level of access to quality healthcare.